Stress inoculation and its variations has emerged as one of the key treatment modalities for people who have anger and aggressive problems. It's now been employed with combat vets, with prisoners, with adolescent offenders, and there are a number of analog studies with college students. It's been applied to people who have rage, driving rage, and so, and this is California, come on, where else is this kind of treatment needed? The stress inoculation has three components, okay? The first component is to develop a therapeutic alliance and conduct psychoeducation. It is designed to develop a supportive relationship where you can do collaborative goal setting, where you can educate people about the triggers, the emotions, the cognitions, the thinking processes, the behavior, and how they get caught up in that. It isn't like you do education and you do treatment. These are highly intertwined. Not only that, the treatment tries to include both assessment and treatment together. So it's not like you do assessment and then you do treatment. You're going to have collaborative goals that you're going to assess on a regular basis. So the first part of this stress inoculation training has to do with the education of the client and significant others. The second is the skills application. And sometimes people bring in skills. So you're going to collaborate with them to learn a variety of skills to break this vicious cycle of how to appraise events, how to conduct some control, to develop control on emotional self-regulation, whether these are relaxation to dampen the arousal, whether it has to do with acceptance kinds of strategies, whether it's cognitive restructuring. So we're going to teach skills that focus in on emotionality, that focus in on cognition, and that focus in on behavioral elements. The third phase, which is really critical, is application training. You want to make the training as similar to the real life situation as possible. So one of the things that becomes really interesting is that we could have rehearsal within the session. We could use imagery rehearsal. We could have graded in vivo exposure. We can get you to perform personal experiments. In fact, if you stay with the concept of inoculation, like a medical inoculation, you can actually see the degree to which an individual can be exposed to lower doses of provocations and learn coping skills. This could be done both on a treatment basis and on a preventative basis. So if you go to the Melissa Institute website, you can read about how stress inoculation training has been used in the Israeli Defense Forces, with soldiers, with policemen. So think about people who have to deal with this on a day-to-day basis, and what is it that you would like those individuals to do, both at an individual and group level, in order to notice, to catch, to interrupt that behavioral cycle.